How is pediatric asthma diagnosed in children? Imagine trying to figure out why a child keeps wheezing or coughing during playtime or bedtime. Diagnosing asthma in children is a careful process that combines listening to symptoms, examining the child, and performing specific tests. It all starts with a detailed medical history. The doctor asks about the child's breathing issues like wheezing, which sounds like a high-pitched whistling when breathing out, coughing, or feeling short of breath. They also want to know when these symptoms happen, what seems to trigger them, and how often they occur. The doctor may ask about family history because asthma and allergies often run in families. This history helps the doctor understand if the child's symptoms fit with asthma or might be caused by something else. Next, the doctor performs a physical exam. They listen carefully to the child's lungs with a stethoscope. Sometimes, they hear wheezing or other unusual sounds. But if the child isn't having symptoms during the exam, the lungs might sound normal. If the child is having an asthma attack, the doctor might see signs like using extra muscles to breathe or a chest that looks puffed out. To get more information, the doctor may perform lung function tests. For children aged 5 and older, spirometry is the main test. The child takes a deep breath and then blows out as hard and fast as possible into a device called a spirometer. This measures how much air they can exhale and how quickly, helping to see if the airways are narrowed. Sometimes, after the initial spirometry, the doctor gives the child a medication called a bronchodilator, like albuterol, which relaxes the airway muscles. The test is repeated to see if lung function improves. If it does, it supports an asthma diagnosis. For younger children or those who find spirometry difficult, another test called impulse oscillometry can be used. This test measures airway resistance by analyzing sound waves during normal breathing, which can also show airway narrowing. Another helpful test is measuring nitric oxide in the breath, called fractional exhaled nitric oxide testing. Higher levels of nitric oxide can indicate airway inflammation, which is common in asthma. However, this test alone doesn't confirm asthma, so it is used alongside other tests and the child's symptoms. Monitoring tools like peak expiratory flow measurements can help track asthma over time but are not enough to diagnose it by themselves. Usually, chest X-rays are not needed unless the doctor suspects other conditions or complications. Diagnosing asthma in very young children can be tricky because many kids wheeze when they have viral infections, but this doesn't always mean they have asthma. Symptoms may not be present during the visit, so doctors often need to observe the child's breathing over time. Sometimes, trying asthma medications and seeing if symptoms improve can help confirm the diagnosis. In summary, diagnosing asthma in children involves gathering detailed information about symptoms, performing a physical exam, and conducting lung function and inflammation tests. This comprehensive approach helps ensure the diagnosis is accurate and that the child receives the right treatment. Parents and caregivers should work closely with healthcare providers to develop a personalized plan that keeps the child's breathing healthy and safe. Always remember, if you suspect your child has asthma, consult a healthcare professional for proper evaluation and care.